It's the PainExam podcast with your host, David Rosenblum, MD. If you treat pain or have an interest in pain management, join us as we discuss painful disorders, alternative treatments, practice management, and more. Be sure to subscribe to the PainExam newsletter at PainExam.com and review the podcast on Stitcher or iTunes. Our high-yield premium episodes are now available on the PainExam app with a premium subscription or access for free with a CME subscription at PainExam.com. And now, without further ado, here's your host, Dr. Rosenblum.
Welcome back, and thanks for listening. We have a bunch of courses coming up, monthly ultrasound courses and a regenerative medicine course in May. I'm looking forward to doing a course at the West Virginia State Interventional Pain Physician meeting in West Virginia on April 14th. It's a great meeting. I spoke there last year, and I think it's going to be a lot of fun. So if you can make it to West Virginia, it's a cool hotel called the Greenbrier. It's pretty famous, so I'm sure some of you know it, been there, heard of it. Anyway, I have a regenerative pain medicine ultrasound webinar with Clarius Ultrasound Company this coming Wednesday. Hope you guys can catch it. If not, the replay will be available on my or their websites. It's always fun doing those webinars. They have we have a lot of good content, and it's a great machine. So definitely check it out. Also, my first ultrasound course of the new year is January 6th in New York, then the 10th, and then in Florida on the 18th. So I hope to see you guys there. Remember, we have board review, virtual pain fellowship for those of you who are interested in delving in deeper. It's basically the PainExam Complete plus a regenerative medicine course and much more. So you can find that at the nrappain.org website, or just go to PainExam and follow the links. So today, I actually was inspired to investigate Traumeel, which is a homeopathic substance that and a rep came to my office years ago, and I guess because of its lack of current acceptance with the FDA, as well as standards of care in the U.S., I stayed away from this, which I'm sure many of you are also doing. But I just randomly found a case report, really 5-patient case study of epidural injections with Traumeel, which I didn't even know you can do, but I guess they did it, and I'm going to tell you about it. So basically, we all know, well, we should know, if most of you are pain physicians, the dangers of epidurals, which are very few, by the way. More of the dangers of corticosteroids, which in the doses we give are typically also low risk. But they can cause, with any injection, not just epidurals, local skin depigmentation, skin fragility, easy bruising, telangiectasia, weight gain, facial flushing. There can be increased blood sugar, as well as any sort of risk to osteoporosis, and there can be cardiovascular changes. And if it's particulate, supposedly a spinal cord infarction if it's injected into a blood vessel. So these doctors, and as usual, the link will be in the show notes, Dr. Ehlert and Dr. Majou, they tried to, they injected Traumeel into the epidural space, which, may be smart, maybe quite ballsy, I guess. Anyway, what's Traumeel? It's Traumeel. Many of you probably never heard of this because it's not standard of care here in the States. It's a homeopathic alternative. It's an anti-inflammatory compound with a recent resurgence in popularity because it doesn't really have the side effects that steroids have. An allergy to one or more of the components of Traumeel, and we'll get into the components soon, is really the only contraindication according to this study. And it's a fixed combination of diluted plant and mineral extracts that have been available over the counter in Europe for over 60 years. There was a classic study done by Lussignoli and company. It was found that Traumeel decreased systemic interleukin-6 production and reduced edema, offsetting an unregulated inflammatory response. In an in vitro study on human T cells, monocytes, gastrointestinal epithelial cells, Traumeel was found to inhibit secretion of pro-inflammatory mediators IL-1 beta, tumor necrosis factor alpha and interleukin 8, suggesting it may have the capability of stabilizing immune cells. Although the ingredients have been used for many years for therapeutic purposes, they include Echinacea angustifolia and Echinacea purpura to increase mesenchymal defense or boost the immune system. The effect of Traumeel was found to be greater than the sum of the active components, with multiple components acting on various phases of the inflammatory response, suggesting a synergistic reaction. And just to go over the list of ingredients, in addition to those, there's Achillea millefolium, Aconitum napellus. I mean, these are names. Some of them I know, some of them I don't. Arnica's one I'm familiar with. That's Arnica, montana. Atropa belladonna. Bellis perennis, Calendula officinalis, Matricaria. Okay, there's a whole bunch of these. This one's actually, Matricaria is recrutita is chamomile. We've all heard of that one, right? A couple of different echinaceas, as I mentioned. Witch hazel. I'm going to give you St. John's wort. There's more ingredients, but I'm giving you the ones that you may have heard of. Comfrey, I'm not familiar with. And then sodium chloride and water are the inactive ingredients. So they use Traumeel to treat inflammatory conditions with efficacy comparable to NSAIDs, oral, topical, injectable preparations, and there's references to these claims in this study I'm reading. There's no known current research regarding the efficacy of Traumeel in epidural injections for short-term relief of back pain, which makes this all the more, I don't know if I want to say brave of these docs to just inject Traumeel into the epidural space. Then again, remember the guy, if you studied your anesthesia history, the guys who first did spinals, they just injected themselves with either, I don't know if it was lidocaine or possibly even cocaine back then, into the spinal. And, I'm surprised they weren't freaking out when they couldn't move their legs, but apparently they celebrated, and I think they got drunk, if I remember the story properly, that they were able to block the nerves of the lower body, and thank God it was temporarily, right? So these guys also were, I guess, pioneers and decided to inject this into the epidural space. And of note, there are no studies that I could find comparing Traumeel to corticosteroid injections, although the Traumeel in the rotator cuff syndrome study protocol outlined a potential method for comparison in patients with rotator cuff syndrome. Here they describe 5 patients with back pain who opted for Traumeel injections due to contraindications to steroids or preference against steroids. It is hoped that they're hoping that this will lay the groundwork for the studies of Traumeel in the epidural space. Currently, I've been doing epidural PRP instead of steroids for patients who prefer no steroids. And it's been working for a lot of patients. I wouldn't say all patients, but I mean, off the cuff, I'd say 60 to 70% of patients are responding. And out of those who respond, many of them are getting longer-term relief than epidurals. In fact, many of them are opting for repeat PRP as opposed to converting over to the epidural steroid group. Anyway, but of note, when it comes to PRP, I'm also doing either the facet disc SI joint in combination to what other problem they need, meaning when the insurance companies are not involved, I can actually treat the patient. This is just a side note. For instance, somebody comes to you with back pain relating to the leg. Evaluation, exam, and MRI can correlate, can confirm a disc herniation causing symptoms, but many times there's coexisting facet pain. So in the olden days, many pain docs would do epidurals with facet injections, but now insurance companies and Medicare frown upon the combination of procedures in one day. So you may help one component of the pain, but not the other. When you're not dealing with insurance companies and you could use a biologic like PRP, which it's just basically the patient pays cash for the procedure, you can actually do what the patient needs in one setting. There are patients who will have a coexisting SI joint pain with facet arthritis or with a radiculopathy, and not having the insurance companies involved will free you up to take care of the problem in one day as opposed to bringing them back for multiple sessions to treat each individual aspect on its own. So there's advantages and disadvantages to working that way, but that's another podcast. Anyway, back to the Traumeel injections. And so they did their epidurals, these doctors. It looks like they did pretty standard stuff. They anesthetized the skin with lidocaine with a 25 gauge needle. Then they use a 20 gauge 2E needle to get to the epidural space under fluoroscopic guidance. Nothing so crazy here. The first case they discuss is a Traumeel injection into the L4-5 epidural space, but the patient reported the pain got better. Then it returned. He went to a surgeon. The second patient, they had a disc bulge at T23. He did not want corticosteroid. So, I mean, I'm a pain doc. First of all, I don't rush to do thoracic epidurals or cervical epidurals on anyone. Okay, they're good procedures that work. However, you're close to a spinal cord. Below L1, there's no spinal cord, so lumbar epidurals I'm much more freer with. But when it comes to cervical and thoracic epidurals, I will typically do a nerve root block under ultrasound in the neck first, or high brachial plexus block. And if it's thoracic spine pain, and this is a little tip if you know how to do this block, I go for a thoracic paravertebral nerve block. And 90% of the time, I never need to do a thoracic epidural. Why? When you do a paravertebral nerve block, you're getting the local anesthetic and steroid in the paravertebral space, which is one compartment, just like the epidural space. So if you're off by a level, it's going to spread up and down. Secondly, there's not much vasculature. You're a little bit more lateral than Adamkowitz and all these other arteries feeding the cord. So I still use dexamethasone to be on the safe side, not a particulate steroid to avoid embolization of the blood vessels. But you're giving a nice dose of local anesthetic to the paravertebral nerve, which is basically a selective nerve almost, meaning the nerve leaves the foramen and you're getting the nerve before it goes anterior in the intercostal space, the other branches to the sympathetics that go anterior, as well as those medial branches that go posterior. You're getting multiple blocks, so you could treat facetogenic pain with this block, as well as possibly even visceral pain, and of course somatic pain like intercostal pain or rib pain. So it's very useful, and most of my patients do quite well with this, and I find myself not really needing to do thoracic epidurals very often. So anyway, I think it's just, I just think it's quite brave to put Traumeel in your thoracic epidural space when, it's a substance I don't really have much experience with, so I would just be nervous about some sort of effect on the spinal cord. But I guess if for 60 years people are injecting this drug into the body, it's probably pretty safe. And I'm saying probably because I don't know for a fact. I'm just regurgitating some information I'm finding on the internet. Anyway, I'm not talking from personal experience here. The next patient is one with an L4-5 impingement. Of course, by the way, this is only 5 patients. This is not a large multi-center randomized controlled trial, so keep that in mind. So the patient got 50% relief and 50% increase she had a 50% increase in function, no change to her pain medication, no side effects of weight gain, but she did have pain relief with the Traumeel injection, and she said that it was comparable to the transforaminal injection at L4-5, which she received. So she was satisfied. Another patient, chronic lower pain to the right side with post-laminectomy syndrome. She did not want the epidural steroid injections because of palpitations and headaches. She opted for Traumeel, Marcaine, and normal saline. Now here they're injecting it with Marcaine. Marcaine lasts 2 to 6 hours. However, from my experience, I've seen local anesthetic injections last for months. So was it the Traumeel or was it the Marcaine? Who knows? Anyway, she had 3 days of greater than 50% pain relief. Well, what about after day 3? It doesn't say. Patient 5, a 45-year-old female with history of bipolar disorder, presents with new onset thoracic pain. Disc bulges were seen on MRI with the most prominent site at T11, T12. She was unable to tolerate the corticosteroids due to the exacerbations of her mental illness. She's bipolar. I guess that makes sense. opted for the Traumeel series. And when I say series, it doesn't say how many injections she got. And PT, she reported 40 to 50% relief of pain, increased range of motion, functionality, and overall satisfaction. No other treatments were offered. So, unfortunately, these authors did not tell you how long the pain relief works. From my experience, if you just inject local or even saline, you're washing away inflammatory mediators, and you will get some temporary relief possibly from these injections, from epidural injections or other nerve blocks. So, I can't really say that this study's convincing me to recommend Traumeel. However, I'm really interested in this low risk side effect profile. It sounds great, and um, you know, one thing that I'd like to explore is where the FDA stands on this, which leads me to a letter written to a Mrs. Reich of Medinatura, which I guess is some company. And it's written June 11th, 2020, and basically it's a warning letter, something from the FDA I never want to receive. It's advising that they reviewed their product labeling, and this is the Zeal injection solution, a Traumeel injection solution, or Engestol injection solution, neuralgia room injection solution, lymphomyosat X injection solution, and Spascupril. Wow, all these weird names. Okay, so basically, the products are concerning from a public health perspective, and these because of the risk of injecting it into the bloodstream with the toxins, microorganisms that could be contaminated, and the injectable contains potentially toxic or otherwise harmful ingredients such as the mercurius sobolus mercury and embryo totalis suis. Basically, it's a risk to the patient. And basically, in this letter, they're asking the person at this company to respond within 15 days to rectify the situation. And it's not an approved drug, and there can be some severe consequences for the selling or mislabeling of this drug, because they're saying it's used to treat conditions, and it's a violation. So, caution, and nobody wants to mess with the FDA or get into any sort of trouble with these things. But I think if a drug's been around for 60 years, the Traumeel, it still may pop its head up and actually become a standard of care drug. Look at PRP. I mean, for so many years in the States, it was considered like experimental, and it is still experimental on some levels. However, for certain conditions, I think it's probably superior to steroids, and I think it's been pretty much established to be superior than steroids. When I mean that, I say look at the knee, for instance. It's been shown to cause pain relief, reduction in inflammation, and have almost no side effects. So to me, that seems superior to steroids, which obviously have more side effects. So in summary, I think Traumeel has possibly potential benefit, but I would not put it in anyone's epidural space until I read more studies on it, until its safety and efficacy has been defined and looked upon favorably by the FDA. So, and just common practice. I mean, I need to see more studies on this. However, Traumeel for some other sort of peripheral arthritis or rotator cuff, well, I still won't use it yet. I need to see more evidence. And if it's been around for 60 years, I'm sure that evidence is out there, but I only have so much time. So if you guys have any experience, I'm open to hearing about it. You have my email. It's on the website, show notes. If you have a chance, please review the podcast on iTunes or whatever modality you're listening to it on. And thank you for listening. Hope to see you guys at either the West Virginia SIP conference or at any of my ultrasound courses, regenerative medicine courses, or online via my board review. Pain management is possibly one of the best specialties in medicine to be a part of, whether you're board certified or you're just looking to offer your patients more. There's so many new things out there. It's an interesting space where you could either manage patients medically or with interventions and really make a difference in their lives. So if you're looking to expand your ability to treat pain and help patients, check out the Virtual Pain Fellowship on the nrappain.org website, or if you're studying for your pain boards, anesthesia boards, or PM&R boards, go to the PainExam, PM&R exam, or anesthesia exam sections of the nrappain.org, or just go to PainExam.com, and I'll see you there. Thanks for listening. Have a great day.
Dr. Rosenblum is here solely to educate, and you are solely responsible for all your decisions and actions in response to any information contained herein. These podcasts are not intended as a substitute for the medical advice of a physician to a particular patient or specific ailment. You should regularly consult a physician in matters relating to yours or another's health. You understand that this podcast is not intended as a substitute for consultation with a licensed medical professional. Copyright 2017, David Rosenblum, all rights reserved. No part of this publication may be reproduced, stored in a retrieval system, or transmitted in any form or by any means, electronic, mechanical, recording, or otherwise, without the prior written permission of the author.